Hello everyone, welcome back to my channel Navjot Talks. This is Navjot, registered nurse in Ontario. In this video, I'm going to talk about pain assessment and how you can use the Pneumonic PQRSTU. There are different type of mnemonics available, but this is the most common one, and you can also use this mnemonic to do all other kind of assessments. So let's start with the video, and the mnemonic is PQRSTU. I will take the example of pain because this is the most common complaint by most of the patients, and most of the nurses, they find it difficult because pain is really subjective. If a patient complains of pain and if they have pain, so you have to consider that they have pain. Now you have to find out how their pain feel like so that you can have a baseline of their health status and can communicate with your doctors effectively. So let's start. P. Provocative or palliative. Provocative means what makes the pain worst, and palliative means what makes the pain better. So is there anything that the patient is facing to make the pain worse? Is there anything the patient is facing that makes the pain feel better, the client feel better? Q. Quality or quantity. Quality means now you have to use some different type of terms and words to give an idea to your client, so that they can pick up word and tell you. So could be, how's your pain? What's the quality of your pain? Is it stabbing? Is it feeling like pins and needles? Is it throbbing? Is it like a sharp knife? So this is something which you can tell your client because it's really hard for them to describe, especially when they're going through that pain. So if you tell them these 3-4 words, they might be able to choose one word and you have an idea what their pain feel like. Quantity. You can ask them, how bad is your pain? Mr. John, how bad is your pain? Could you describe me a little bit about it? Now this is a why question, and then they will tell you, I was not able to sleep because of this pain. I could not eat because of this pain. So this is like quantity of the pain. Now you know that this is the level of the pain. And then comes the scale or severity. You ask your patient, can you rate on a scale of 0 to 10 what is the present level of your pain? They might say it's 10, but then you also have to tell them 0 being the no pain and 10 being the worst pain that you ever experienced in your life. For example, a pregnant woman or a mother that has given birth to a child before will compare that delivery pain with the pain that she has now. It will give her a better understanding of how she has to rate her pain, because if the pain that she has faced during delivery was 10, then the pain that she's facing now could be 5 or 6, and then she can give you a better figure based on that comparison. So P, Q, R, S, and then comes T. So T means treatment or the timing. You can also ask your patient, is there any time of the day when their pain goes away? Is there any time of the day when they have worst pain? Is your pain continuously there? Is your pain constant? Is your pain intermittent? So this is something which you can ask them. You have to elaborate on the questions, because if you simply ask the question, what time of the day your pain is worse, you might have to elaborate a little bit. You have to say, hey Mr. John, there are some types of pain that go away when a patient lies down. There are some type of pain that originates when a person has eaten the food. So you have to elaborate a little bit. And then comes the treatment. Why treatment is important? Because it will help you to understand what medications they have taken and was it effective or not. So you might ask your patient, hey, is there any medication that you have taken? Mr. John, I know you are going through a lot of pain, but did you take any medications? Did you take any home remedies for this pain? They might have taken Tylenol and they might not tell you, so it will not help you to formalize a proper plan of care. So if you know that they have taken Tylenol, they have taken Advil, now you can communicate with the doctor. The doctor, this patient has complained of pain, rating on a scale of 0 to 10, 9, and this is really radiating towards the back, and the patient has taken Advil and Tylenol. Within an hour, it was not effective. And then comes U, which means understanding. You might ask your patient, why do you think you have pain? Mr. John, do you know why you have pain? Do you have any things to say about this pain? Did you ever have this pain before? So it's you means you have to ask your client, or understanding of the client. Sometimes a patient may have something in their mind that will really change the whole picture. So if a person has faced that kind of pain before, or if a person has eaten spicy food at night, and they might say, I always face this type of pain whenever I eat spicy food, and this is what I did last night, so I have this unbearable pain now. So now it will kind of give you an idea and will entirely change your whole focus, because you might be thinking it's related to the heart, but now it's heartburn. So you can ask this question. And so this is the mnemonic that cannot be used if you don't have the proper picture in your mind. What questions are you asking? So you cannot simply ask what's the quality of your pain. This, you have to use this mnemonic in a very clever way, that you have to elaborate on each and every question. Like, this is a quick way to do the pain assessment, and this is a mnemonic that you can also use in order to do other assessment. For example, if you are monitoring a client who is complaining of itching, so you may ask, hey Mr. John, you are facing itchiness, but can you tell me a little bit more about itchiness? And this is also a mnemonic that you can very easily use for other type of assessment. For example, itchiness. If a person complains of itchiness, you might ask the similar questions and they will give you a very good idea based on your question. So you may ask, what's the quality of this itchiness? If can you rate this itchiness on a scale of 0 to 10? The same way, 10 being the worst itchiness you ever had in your life and 0 being no itchiness at all. And the severity, how bad is your itchiness? They might say, I couldn't sleep because of this itchiness. I had to take 3 showers, but still it's not going away. And then the timing, is there any time of the day when your itchiness comes up or it goes away, or anything that makes it worse or better? So they may say, whenever I go near to this particular perfume, or I go near to this snacks, I feel this itchiness. And you may ask them the same way, understanding of the itchiness. Why do you think you have itchiness? They might say, I just started feeling it. I don't know what happened. I had this itchiness before when I was in grade 10. I had this itchiness before when I went to this mall. So they might be able to relate, and then you can have a better picture of this. Could be related to an allergy, or could be related to a side effect of anything. And it helps you to talk to your doctor in an effective way. You will see that if you use this mnemonic, your skills to communicate with the doctor will change in a tremendous way. You can use S-bar, and then for S-bar you can use this information. I'm going to talk about S-bar in another video, and how you can use it as a tool to effectively communicate with the doctors, and how you can get a better response from the doctor. Till then, stay tuned to my channel. Don't forget to subscribe. Don't forget to leave a like if you like my video. You can also dislike my video if there is a change that you want me to make in my videos. I can certainly take it as a good feedback. Constructive criticism is also important in our life. So don't forget to subscribe to my channel. Don't forget to share. If your friends like this video, they might get some idea how they can use it in the nursing skills, to enhance the nursing skills. I will see you in next video. Till then, take care. Bye bye.